on healthcare now!
End the siege on healthcare now!
My name is Bridget Rochios. I'm a midwife here at San Francisco General Hospital and a nurse practitioner at UCSF.
And there's an International Day of Action today for the doctors who've been kidnapped, murdered, the destruction of the last hospital. Talk about what that means to you about what's going on here today and what's going on in Palestine.
Yeah, so we're here today from a national call from Doctors Against Genocide to call in sick of genocide on January 6th, 2025. We have been out in the streets since the end of 2023, organized as healthcare workers, calling on and urging our communities and our governments to stop funding this genocide and this attack on healthcare workers. What we have seen over the last month has been the, systematic destruction of the last functioning hospital in northern Gaza, Kamal Adwan, and the taking of, imprisonment of, and likely torture of Dr. Safiya, the medical director. And, this is nothing new. I was in Gaza in May of last year, and what I saw was a very clear and systematic attack on every single hospital and on healthcare workers. Everybody had a target on their back. The healthcare system is in a beyond catastrophic state. And so we are here in solidarity with our colleagues to support them, and also in support of all of the people across the world who desperately need medical care, specifically in Gaza.
And right here in San Francisco, in the United States, people are being denied health care. They can't get health care benefits. There are cutbacks, and also the Trump administration want to destroy public unions, public health care. What does the future look like? Because it seems the attacks on health care for people in this country are going to grow.
Yeah. I think that it is really clear that, it is no coincidence that a government that is signing billion-dollar checks to destroy innocent families and people in Gaza is also at the hands of a, insurance oligarchy here in the United States, where healthcare is not freely accessible, and that their health equity issues are so clearly racialized. As a midwife, it is very clear, and studies support that, and data supports rather, that Black pregnant and birthing people are many times more likely to die during childbirth or in their time postpartum than their white counterparts or counterparts of other races, and the same goes for Black babies. They're far less likely to survive their first year of life. And women's access to healthcare without discrimination, women's access to healthcare like abortion, is all interconnected to the reproductive health crisis that is happening in Gaza right now, where women do not have access to safe places to give birth or to take care of their children.
And you personally experienced this as a medical healthcare professional going to Gaza. How did that change you, and what happened there?
Yeah.
When you were there?
Yeah, I think that, for me, what happened is everything that you're seeing on your screens every day. I'm here to confirm and verify that, this is not some sort of propaganda. This is true reporting of what is happening, which is famine, which is a lack of access to all things, which is the displacement. Well over 95% of the people in Gaza are displaced into tents during now winter months where there's rain and cold. What my experience has done is only further solidified, my desire to be, at actions like this today and to speak up against, healthcare, the lack of access to healthcare for everybody in Gaza, as along with, the lack of access to healthcare here in San Francisco.
And there has been retaliation against doctors, medical people who have spoken up, who even wear a watermelon, and you have a watermelon t-shirt. What is going on as far as the effort to silence people and to intimidate people?
Yeah, the effort to silence people, especially at some institutions within San Francisco, specifically UCSF, is incredibly aggressive. I'm currently on month 7 of an administrative leave for wearing a watermelon at my clinic, at my place of work.
How dangerous.
Yeah, right. And it is very clear the fact that, the healthcare system is very interested in profits over people, and this is an issue that is on big conversation over the last month or so in this country about the way the medical institution has been set up, the way insurance providers deny coverage to people, and I think that it's very clear that they want us silenced, and more specifically and disappointing, they will not themselves speak up amidst a public health crisis. And, all of the institutions in San Francisco really purport to be great supporters of health equity, global health justice, all of these things. Yet in this moment, when we are seeing so clearly, thousands of healthcare workers murdered, when we are seeing so clearly an entire healthcare system obliterated, they remain not only silent, but they try to silence those of us who are speaking up in solidarity, and they refuse to divest pensions and other investment funds from the military-industrial complex. And it makes no sense that healthcare institutions are profiting off of genocide and supporting genocide.
And the structure of the university, the regents, they're not elected, they're appointed. Many of them are supporters of Israel. What has to happen as far as a structural change so that this institution is going to represent the people of California and respect the interests of people and not the profiteers?
Well, they need to listen to us. We've been out here, constantly since the end of 2023, demanding all of these things. And I don't know about the complete, political structure of kind of the regents, but I do know that they aren't listening to us and that we are demanding that happens, or that there is a shift in who's in charge and who is making these decisions and who is allowing funding from really evil sources that are supporting genocide.
Okay, thank you.
I'm Ansel. I'm a physical therapist at Highland Hospital in Oakland, and I'm here to support my colleagues and just make a very clear statement the impact that this targeting of hospitals, that the targeting of healthcare workers, all of the abductions, the killings, not to mention the broader genocide in Gaza, the occupation in the West Bank, the escalation to other countries like in the Middle East. All of this is having a hugely damaging effect, not only on the communities involved, the people being killed personally, but on us thousands of miles away as healthcare workers. We feel the targeting of our colleagues overseas acutely. It's a real loss. It's such a moral injury. And we need the hospitals to take a stand. We need the hospitals to stop being silent, to stop trying to be neutral, and to really support healthcare workers like us, like our colleagues in Palestine.
And also, you're fighting for healthcare for your patients. Highland Hospital, there was a strike there against privatization and the conditions. How is that connected to what's going on in Palestine?
That's an interesting question. I think we can see a connection in how hospitals here are being privatized, or in Oakland unsuccessfully. We won that fight. It's still a public hospital, but there's the degradation of hospitals and the whole healthcare system in Gaza, for example, is intimately connected to how hospitals here are losing funding, how the healthcare system here is deteriorating, because the wealthy all around the world are not going to lose their healthcare access when the hospitals go down. They're always going to be able to pay for private clinics. But the people that we serve at Highland Hospital, at SF General, those are the people who lose out when healthcare systems are gutted, when the ability of the people through their government to provide healthcare services to the needy is lost.
And the Biden administration says they want to send another $8 billion for military weapons to Israel. Trump has said, finish the job of destroying the people of Gaza. It seems like there's a real political vacuum for an alternative vision of what needs to be done.
It does seem like that. If you're looking to the two big parties to solve your problems, that neither of them is offering us a choice, right? We see one party as totally genocidal, gave tens of billions of dollars, not just 8 billion, I think it's upwards of 50 that the Biden administration's already sent to Israel. Trump is talking about even more funding. If one party's actually supported the genocide for the last year and the other party's talking about finishing the genocide, we just can't depend on the Democrats or the Republicans to represent us in Washington. We need to be building the popular support for actual democracy in this country.
And the SEIU has taken a position for divesting in companies that do business. They also are supporting a blockade of military weapons to Israel. Do you think the rest of the labor movement should join in taking action to stop this continuing genocide?
That's a really good question. Absolutely. SEIU taking that stand, that's my union, SEIU 1021. They were late to it, but we got them there. went through a lot of organizing within the union.
Took a big push.
It took a big push. We just got Alameda County, first county in the U.S. to support divestment from companies like Caterpillar. They've already moved to pull their money out of Caterpillar, which I believe was $22 million. And other funds that they're invested in are going to follow suit. The more that we have unions, counties, other forms of government, other big retirement pension funds, divesting, the more that we'll see these companies' stock prices starting to take a hit, and the more that will pressure these companies to actually reconsider doing business with the apartheid state of Israel. So we can see there's some change that can happen within capitalism without the US government actually listening to the people, the majority of whom want to see an arms embargo in Israel. I don't know if you've seen those poll numbers.
They don't seem to pay attention to those things.
No, they don't.
The profiteers are more important than, you're profiting here by denying health care and then profiting by bombing hospitals and the militarization.
That's right. And even outside of the profiteering motive, what we see in Israel and in terms of what is the state doing in Palestine and the West Bank, it's very akin to what the US state did in the genocide of indigenous Americans. It's a very similar model. It's just part and parcel. These governments think alike. They recognize each other. They have shared interests. We need to demand not only that they change, but we need to demand an actually representative political system in the U.S., in the Middle East, that's going to represent people's interests, because they don't listen to us.
I'm Lauren. I'm a social worker, and I specifically am a trauma therapist. Just devastated by the continued devastation of infrastructure in Gaza. I think our work is specifically UCSF, as the UC's investments in companies that continue to profit from the genocide in Gaza. It's impossible to not see how deeply complicit as an employee of this institution we are. So that's why it feels really important to be here today.
It's several different campuses or hospitals are doing this, including Stanford and I think at UC Davis, but it's a Sick from Genocide vigil for healthcare workers are demanding an end to the genocide in Gaza. Healthcare facilities have been targeted. We're saying that healthcare facilities should never be a target. Healthcare workers should never be a target. Children should never be a target. One of their main campaigns is not another hospital, not another child. So we're here as part of that because we don't want our tax dollars going to fund genocide when we have millions of Americans who are one serious accident or injury away from financial disaster. So what is it, $18 billion in the last year and a half we've sent? It's ridiculous.
And what is the reason that the United States would be funding this genocide? It's killing thousands and thousands of children and people. Their homes are being destroyed, hospitals, all the educational institutions.
That's something I ask my Congress people when I call.
Who have you talked to?
I've talked to staff people with Butler's office and Schiff's office, Padilla. I usually just leave a message. So honestly, I don't know why, because most Americans don't want this. I mean, I think the recent polls are 61% of Americans don't want to continue sending our tax dollars there for genocide. Most Americans don't want this. So I don't know what our elected officials are doing or why.
And as a healthcare worker, when you see this destruction every day, hospitals being raided, hospital workers being killed and being kidnapped. I mean, the present hospital director that was at the hospital, maybe you can talk about him.
It's just heartbreaking because these are people who are saying they're doing what doctors and healthcare workers are supposed to do. They're saying we will not leave our patients. 37 hospitals have been attacked, and at every single one, El Shifa, Kamal Adwan, doctors and healthcare workers are saying they've been asked to evacuate, and they're saying we're not leaving our sick patients. That is what we're supposed to do. That's what we've taken an oath to do. And for them to be killed and detained for that, it's heartbreaking.
They're putting their lives on the line for the patients and for the people.
Exactly.
And what can people in this country do? Your healthcare workers are becoming mobilized. The SEIU, some unions are supporting a campaign to stop the military arms to Israel. What do you think needs to happen?
I think more and more Americans should be demanding answers from their elected officials about why our tax dollars are going to this. There's the BDS movement. Let your voice be heard.
I'm Jed Bell. And as a pediatrician, I believe that all children have the right to health and to life. And I think here in the States, that's not happening. The poverty rate is going up for children. And I also think that in other countries like Gaza, unfortunately, the health of children is being significantly decimated, with 20,000 kids that have been killed by US-funded bombs that are going through Israel. And it's not just the children that are getting attacked, but also my fellow healthcare workers. And so that's why I'm here to advocate for them.
And why do you think the United States continues to fund? Biden just announced he wants to give $8 billion more to Israel for their military needs. What's going on?
I don't know. I can't put any sense to it that the fact that we've seen documented multiple war crimes, that we've seen documented attacks on healthcare personnel, on civilians, that the largest numbers of those killed in Gaza by Israeli bombs are 5 to 9-year-olds. That's the age group that's most affected in terms of deaths. But I don't know how our elected officials can see those numbers and not really make any changes to the amount of, like you said, $8 billion that's now Biden is trying to push through right before he leaves office.
And at the same time in this country, people are being denied health care benefits.
Absolutely.
People are dying because they can't get medication because of the insurance industry. What does that say about the American system?
Exactly. And I think the system here, the healthcare system is built, unfortunately, in a way to profit our elected officials. It's built to profit the CEOs of health insurance companies and big hospital systems. But it's not meant for the health of Americans. 25 million people were taken off their medical aid last year. And the health outcomes in the States are unfortunately getting worse. And instead, the United States spends vastly more than all of its allies on military and bombing other countries and sending military aid to other countries that are also, as documented by Amnesty International, as documented by the UN, as documented by Human Rights Watch, committing a genocide.
And trillions for war. But there's a problem with health care for all Americans.
Exactly. It's kind of pretty. The irony is that the U.S. sends so much money to Israel, which has universal health care, but here people are struggling to get health care. People are struggling to pay for it. People are going into debt for getting health care. It's the number one cause of, personal debt in America is health care debt and health care costs.
And these tactics of Israel, some have said it's a fascist government. It's a racist government, the way they look at Palestinians and Arabs. Do you think there's a danger of fascism in this country?
I think that there have been concerning trends worldwide. I don't know where this country is going. I know that we just have to come together in solidarity with each other to make sure that we stand against any form of oppression, any form of marginalization, and any form of violence, which unfortunately is something that's perpetuated in the current system.
Safiya, pediatrician.
So you're here in front of the San Francisco General Hospital, called by Zuckerberg now because he gave a $75 million contribution. Zuckerberg is actually taking stuff off of Facebook around this issue. But you're here today on the issue of healthcare workers in Palestine. What is going on there with healthcare workers, and what are the concerns that you and other healthcare workers here have?
I'm concerned because physicians, nurses, pharmacy technicians, healthcare workers are being killed at astronomical rates, and it's they're not following the rules of war. There are rules set by the ICC, by the UN, and people are being killed who should never have been even close to battlegrounds. Children are being killed, they're being maimed. It's unfortunate. And as a pediatrician, first do no harm. I can't just stand by and let children die and have their lives destroyed, multiple, amputations. That's not okay. Whether it's my colleagues, a pediatrician was kidnapped by the Israeli forces, that's not okay. Children, that's not okay. It's a really sad situation.
And healthcare workers here are also fighting to protect their own patients. People are losing their healthcare in this country. You have the United Healthcare situation where they're denying benefits to people in this country who need health.
Yeah, that's highly unfortunate. I would prefer to take out the middle people and just establish universal healthcare. Healthcare is a human right.
And it seems that while people are suffering here around not getting health care or going bankrupt in their effort to get health care, we have unlimited money for Israel, $8 billion more they want to give. What is it with the United States with the trillions of dollars going to war, yet people here are suffering and can't get health care?
Well, my understanding is it's a form of legalized embezzlement. We pay the taxes, and then the government pays contractors, so the contractors are making money, and we're suffering for it.
So while they're making money bombing people from the war,
exactly,
they're also making
dying
money.
And we're dying.
So there's a connection.
I believe there is, yes.
And what can people in this country do? Because the majority of people, according to polls, are against more military aid to Israel, yet the government seems, both the outgoing government of Biden and the new government, Trump, say that they want to continue this.
I mean, a very small percentage of Americans voted in the past election. I'm not sure that we had either option I'm not sure that either option would have granted universal health care, but I think we need to keep working in local elections, keep doing protests, standing up for what we believe in, and eventually, hopefully, our leaders will start to change that, to get money out of politics, to where politicians are no longer allowed to invest in some of the military-industrial complex, because we're paying them a salary. They shouldn't get extra money from their investments that are going towards companies that are killing children.
Okay, thank you. And last, the stress of trying to take care of your patients, and then on top of that, seeing what's going on, that must have a stressful, big effect on the healthcare workers here.
Yeah, I work with babies. I work with newborns. And so it breaks my heart when I see pictures on social media of babies that are being killed in Palestine, in Gaza. It's not okay. I've spent my life trying to help babies have a better time, survive their deliveries, and then I'm just watching other children get murdered. It's heartbreaking.
I'm Brenda Barros. I work at San Francisco General. I've been there for over 40 years.
And you're here today. There's going to be a rally of healthcare workers around the issue of Palestine. What does that have to do with healthcare workers here in San Francisco and SEIU members?
It's all connected. We can't be in healthcare and we see all this destruction and death and what's happening to those people, and everybody's acting as if nothing is happening. So we have to keep bringing attention to that with the goal of trying to stop it.
And you're fighting here for more staffing. There's a problem of covering the patients or patients who don't have health care that are coming to San Francisco General, and yet it seems like there's unlimited money for more money for weapons to Israel and Ukraine and around the world.
Well, I really feel like we spend way too much money on things like that. There's housing issues. There's all these other issues where our government could be spending money that they're not. They're choosing to spend it on war, and based on this new regime that's just taken over our country, that will just increase.
And the issue of attack on public workers, the SEIU 1021 has been leading local, calling on an end to military weapons to Israel, but it seems like public workers are on the gun side of the Trump administration. They don't believe in public unions.
Absolutely, we have fear. We have fear based on this new regime that's taken over and on the impact it's going to have on us. They've proven they're not friendly to public sector workers. they really don't care about the people actually doing the work, which is us. But then they talk out of their mouths on one side saying, oh, they're not going to touch Social Security, they're not going to do this, they're not going to do that. But all indications show that they're just not being honest. And so we're going to have a big fight on our hands, and the more we all, the real people in this country, stick together to fight these issues, the better off we're all going to be.
And unions have tremendous power when they come together. What do you think unions should be doing that they're not doing right now?
I think first thing unions should be doing is educating their members on this issue. Because unfortunately, a lot of our members, they listen to Fox TV and they watch Fox News, and people's tendency is to not want to think about things like this because it is hard when you think about all the death and destruction that's happening. For what reason? No real reason other than what I see is, a lot of old men that can't get along. And all these people have to die because of it.
Hi, I'm Dr. Lee Kimberg, and I'm a primary care physician at San Francisco General Hospital and a professor of medicine at the University of California, San Francisco.
And this day of International Day around healthcare workers in Palestine, doctors who've been kidnapped or killed, how is it happening and why is it happening and what is the purpose of it?
Right. Doctors Against Genocide has put out an international call, a day called Sick from Genocide, to highlight that all of us, healthcare workers included, are sick from genocide. We're sick from watching our tax dollars spent on killing people, the Israeli military killing people in Gaza.
And healthcare workers here face also a problem of taking care of their patients. No money, cutbacks in money. Is there a connection between what's going on in Palestine and what's happening in this country and at San Francisco General UC?
There is a direct connection between the destruction of the healthcare system in Gaza and the genocide in Gaza, and how my patients in the safety net in San Francisco are suffering. So our tax dollars are going to, first of all, here, a for-profit healthcare system instead of a universal healthcare system, and they're being spent on weapons, bombs, and military aid to Israel instead of on the housing and food that my patients need here.
And the Biden administration says they want to send another $8 billion, and Trump has said that he wants them to finish what they're doing. How does that feel as a healthcare professional who's been standing up and saying we've got to stop what's going on, we've got to stop the genocide?
Right. I think that beginning in October 2023, when we first heard Israeli officials calling Palestinian people human animals, those of us who work in violence prevention, like I do, knew that with those statements and with the bombing of Al-Ali Hospital in mid-October 2023, that this was genocide. There was the intent to commit genocide. We said so then. We were repressed and attacked by our own employers and our colleagues and the public for using the word genocide. This is clearly a genocide. Now, what this is the Israeli government has clearly, many in the government have clearly stated that the intent is to exterminate the Palestinian people. So we are sick from genocide. It is a moral injury, it's a spiritual injury, a psychological injury, and it's making our patients sick, it's making people in this country sick. The vast majority of people in this country do not want weapons sent to Israel to kill Palestinians. They want Palestinians to be able to live and to have freedom.
And there, as you say, has been retaliation, pressure. People have been retaliated against for wearing a watermelon.
Yes.
What is that all about, and how is that going on, and is there an organized campaign to stop it?
There's been very intense repression. We have experienced it here at UCSF very intensely. So our care advocate, who is a person who was hired to do violence prevention work, was actually fired. She's been given notice of her firing for standing up for another one of my colleagues, Dr. Maria, who is now on suspension for her advocacy for the Palestinian people. We have had nurse placed on suspension multiple times for simply wearing the pin that I am wearing, a watermelon pin. I will say that on this campus, when I wear this watermelon pin to clinic, I have had patients burst into tears and hug me, tell me that they are Palestinian, which they never felt safe saying before in our healthcare system. I've had patients from many different countries tell me that this is a moral injury to them, that our tax dollars are being sent to murder Palestinians. That is harming all of us. And people are suffering from witnessing this. And honestly, my patients actually understand that the lack of respect and care for Palestinian life is the same lack and respect and care that they receive in the United States. They know it's connected. So I've had a nurse come up to me, hug me, almost burst into tears on this campus at San Francisco General and say that they thank me so much for wearing a keffiyeh on campus. They described to me that witnessing every day dismembered and murdered children and healthcare workers on their phone, and then coming to work and experiencing utter silence of our administration, silence from colleagues, and just a real chilling effect. And it is human beings, as Doctors Against Genocide has put out on their website, and I recommend going there and reading the materials they have about this call for Speakout, for Sick From Genocide call. I recommend going there because they describe in detail the health effects that it has on all of us, and especially like healthcare workers as well, when we watch this total disregard for humanity and human life. We stand for health for all. We stand for doing no harm, and to witness the entire medical system in Gaza destroyed, and then here are institutions silencing. I was just reflecting with another reporter who asked me how long I had worked here, that I came to this hospital in 1991 because this hospital was an international beacon of hope in the HIV/AIDS pandemic. This hospital stood against hate, stood for humanity and human life, and to witness now our hospital not taking that stand publicly, not saying that this genocide must end, that there must be an arms embargo now, not saying that our colleagues, including Dr. Abu Safiya, who is currently being held in an Israeli prison, whereabouts unknown, not saying that our colleagues, our Palestinian colleagues in Gaza, should not be being tortured, kidnapped, sexually assaulted. That silence is deeply painful on top of witnessing this genocide.
And there was a tribunal on UC last month around the issue of the accountability of UC regents and management. What happened at that, and why was that important? And I understand there's going to be one in Los Angeles.
Yes, so the UC People's Tribunal for Palestine, which you can also find online, we are collecting over the course of at least a year, we are collecting evidence about the impact of genocide and the direct connections between academic repression and police violence on our campuses against people standing up for the freedom and the life of Palestinian people. And so if you go to the website for the UC People's Tribunal for Palestine, you will see a large trove of evidence both about the direct impacts of the violence on the Palestinian people and the repression and the violence on those of us who advocate for Palestinian freedom and life. We plan to do another tribunal in the spring of 2025 at UCLA, where there was very intense police violence. Multiple people, students and faculty were hospitalized from being attacked while UCPD stood by and allowed them to be severely and gravely injured. So there will be another tribunal at UCLA in this spring.
I am not involved with the journalist. I'm mostly involved with just stopping the horror, the genocide, the murder. This I'm doing as a favor for someone else to hold this particular sign, but I'm called to just stop the killing.
Hey, my name is Tamina Khan. I want to see an end to the bombing, the killing, the genocide in Palestine. I want to see people protected. I want to see Dr. Abu Safiya to be freed, and we want liberation. Yeah. Demand an end to the genocide, but also to demand the release of Dr. Abu Safiya and humanitarian assistance, humanitarian health care for the people of Gaza.
Free, free Palestine!
Free, free, free Palestine!
Free, free, free Palestine!
Free